In today's video, we have a patient who is a 10 months old baby with history of respiratory distress syndrome at childhood, and then at this age now presenting with noisy breathing. A diagnostic bronchoscopy, as you can see in this video, shows a bridging fibrotic stenotic scar and causing airway obstruction and noisy breathing. So we use a thin scope. The patient is intubated using an IGL, and I use an electrocautery knife to cut the bridge. As you can see, the knife is activated, and then the fibrotic bridge is burnt. And then the fibrotic scar is released, and then you can see the stenotic area. And then we try to pass a flexible bronchoscope to see the distal end of the involvement, and the distal end looks quite normal without any involvement. And that's the left main. That's the right main and the left main. So the whole area beyond the stenosis remains normal, except the subglottic space where you have the fibrotic bridge causing airway narrowing. Following electrocautery cuts, we use a small balloon to dilate the stenosis. And then with the balloon, you can see the luminant patency is achieved. Yeah, you can do it many ways, like you can use a laser to achieve the result here, but here we use a small electrocautery knife, high frequency knife. And then on the edges of the stenotic web, what we do is we use a 1.1 millimeter cryoprobe to devitalize the tissue, so that that can prevent recurrence in such cases. So what we do is we just use a 1.1 millimeter cryoprobe, and then do freeze thaw cycles around the web, making sure the whole area is devitalized using the cryoprobe. Activation times can vary depending on the case and the thickness of the scar. And there is good amount of literature coming on the cryospray in such cases, but we only have contact cryo, so we use a 1.1 millimeter cryoprobe from RB through a thin scope, through the working channel of a thin scope, and then try to do the cryotherapy here, as you can see. multiple freeze thaw cycles are being performed. And then once you complete the cryo application, again you can use a balloon to dilate the stenotic segment. That completes application of the cryoprobe, and then again a balloon is inserted. And then the area is dilated. So completion of the procedure, you can do a quick run bronchoscopy, and you can see the lumen is well established. And this is the comparison picture between the pre and post operative imaging.